wear the mask, because you will find that if you do that in a healthcare setting, everybody will ask you, do you have COVID? And then you have a chance to say, no, I don't have COVID. You need to be wearing a mask to prevent you from getting a COVID. All healthcare providers should be doing this. Starting November 4th, NIH will require mask wearing at their clinics. Right now, though, no one's wearing masks, at least not in Kentucky. The second thing people can do is to bring a CO₂ monitor and monitor the air quality indoors. That is so important. If your CO₂ levels are high, you're going to be more apt to catch infectious diseases. And if they're very high, you may have some mental slips of the healthcare provider that's treating you. For example, during one of my visits, the PCO2 was 1200. Now, outdoor air is about 420, 430. It was 1200. And above 900, you start to have cognitive decline. At a healthcare or at a PCO2 level of 1400, there's a 50% decline in cognition. So this was 1200. So not only was I at risk of an infectious disease, but the healthcare provider was at risk for not thinking clearly. And the next visit, I talked to the healthcare provider about this. And one of his statements was, you know, I've been noticing I've been getting really tired lately in the afternoon, and I was wondering if the air wasn't quite good. So, you know, when one is tired, you may make a mistake. You may slip up. And so having proper ventilation, it's important for infectious disease, but it's also important for overall safety. And that is one of the reasons why carrying a CO₂ monitor is of utmost importance. And of course, you want to have hand sanitizers, everything else when you go into a medical facility.